Hi, my name's Nina and I'm an asthma nurse, and I'm here today to talk about what an asthma attack looks like from a nurse's perspective. What we do know is that when you encounter something that triggers your asthma, so this may be an allergic trigger such as pollen or dust, or it may be an irritant trigger such as being in a polluted area, this causes the smooth muscles to constrict around the airways, which makes them really tight. And then you feel like you have chest tightness, or it may feel like someone is sitting on your chest, and it makes it very difficult to breathe. The linings of the airways also become very inflamed, and it causes cells in the airways to produce lots of mucus, which further blocks the airways and traps the air in the chest, and this makes it very difficult to breathe. It also may cause things like coughing and wheezing, which you may be able to hear, but you may not be able to hear. When the air becomes trapped, it's just very hard to breathe out. So that's usually the main feeling, that on expiration, you're finding it very hard to breathe out. One of my roles as an asthma nurse is to educate my patients about being aware of their triggers, what makes their asthma worse, and actually early warning signs of an asthma attack. It's always really good to avoid our triggers if we can. So for the moment, we know that the pollen count is quite high, so we'd say reduce strenuous activity outside, particularly when the pollen count's high, making sure you're treating your hay fever as well. Other things you may notice when your asthma is worsening is that you're waking up at night time because of your symptoms, or you're using your reliever inhaler more regularly, so usually more than 2 to 3 times a week, or you're finding that your asthma symptoms are stopping you doing things you want to do. If this happens, it may be you need to use your reliever inhaler more regularly, but it's very important that if you're not feeling better, that you see a healthcare professional so they can assess you and hopefully stop it from being an active asthma attack. The signs of an active asthma attack is that you feel like your reliever inhaler isn't working. Other things could be that your reliever inhaler isn't lasting as long as you would usually expect to. So for example, if you use salbutamol as your reliever or Ventolin, we'd be expecting that to be lasting 4 hours. If it's not lasting 4 hours, it's a sign that you could be having an asthma attack. The other things you may see is that you're not able to speak in a full sentence, so you're having to pause to take lots of breaths, so you're finding it difficult to talk or walk or eat easily. Another device that's quite actually useful to use at home, and we encourage our patients to use this to monitor their asthma, is something called a peak flow meter. So this is something that is blown into, and it measures how much air that you're blowing out. So we hopefully will know what your best peak flow is or your expected peak flow. And if we notice those numbers are dropping, that is a sign that your asthma is worsening. And for example, if it's half of your best, we would say that is a sign you're having an asthma attack. From the nurse's perspective, what I would be seeing is that I would see your oxygen levels reducing. I'd be seeing your respiratory rate, so your breathing rate, how quickly your breathing would be increasing. I also may see that your heart rate's increasing, and you might maybe become very tired. You wouldn't be able to interact with me as well, or you may have a blue tint around your lips. That will be a sign that you're having an asthma attack. It is really key that everyone with asthma has an asthma action plan, because this is a really powerful tool that will help to inform you what to do if you notice that your asthma is getting worse, because it's maybe something that doesn't happen day to day. We know that asthma is a chronic condition. There are times when it's good and there's times when it's not so good. That's why it's really important that you have your asthma plan and it's available to you, so you can have a written plan, but digital plans are also available, and this will tell you what medications you take and also how to increase your reliever medications and what to do if you notice your asthma is getting worse.